All right, I think we can go ahead and get started. Welcome to today's webinar titled How Rural Communities Overcame Challenges During the COVID-19 Pandemic. This webinar is being supported by Walmart.org, Save the Children, and No Kid Hungry. Before we begin, we wanted to share that the slides, along with a recording and an accompanying resource, will be shared via email after the webinar. Please ensure that your microphone is muted throughout the entirety of the webinar. And in terms of questions, if you have a technical related question, please use the chat function located in the toolbar at the bottom of your Zoom screen. And if you have a question for a panelist, please use the question and answer Q&A function in that same toolbar. Next slide, please. On today's webinar, we will have opening remarks from Rachel Spencer from Walmart.org, a general overview from Tamara Stanberg from Save the Children, and myself, Anessa Bontrager from No Kid Hungry, and a discussion with our experts, Katie Rogers from Jerome School District and Rachel Jones from Farm to School Park County. So Rachel, I'm going to pass it to you to officially kick off our webinar.
Wonderful. Thank you all. It is great to be with you all today. I'm Rachel Spencer. I work on our community resilience team at the Walmart Foundation, and I have the privilege of leading our local work in Northwest Arkansas, as well as our national food systems work, along with Eileen Hyde, whom some of you may know. And in our national food systems work, we focus on improving access to healthier foods in communities with no or limited food access, and also creating culturally relevant and positive experiences with trying and preparing healthier foods. I know that both of those are likely near and dear to the hearts of many on this call today. This project was so critical in getting to needed geographies in a time when rural communities needed it most. And we really deeply value the power of leadership and creativity this group displayed in adapting to constantly changing, challenging circumstances. We also appreciate you all taking the time to come together today to convene and reflect and learn, and looking forward to a great discussion. Thank you so much for your work.
Thanks, Rachel. Now we're going to dive into the Rural Learnings Project and what we learned during the process. Let's start with how we got here. So on a high level overview, No Kid Hungry examined our grantees between March and July of 2020 who identified serving exclusively rural communities within their applications. This totaled 254 grantees. And as I'm sure you are very aware of, this time frame of March to July was at the height of COVID-19 restrictions and the beginning of remote learning for most. We created a visual dashboard based on data points of interest in order to generate questions and test hypotheses, and then created a survey to send to those 254 grantees that would gather more qualitative information. So we really wanted the words that described the data that we were seeing. 125 grantees responded to the survey. From there, we invited 20 survey respondents who had unique and innovative responses that we felt like we could really learn from to take part in focus groups. Of the 20 invitations that were sent, 16 accepted and participated, 2 of which you will hear from shortly, as they are our experts in the Ask the Experts section. It should be noted that the research included in this presentation was made possible through funding by the Walmart Foundation. However, the findings, conclusions, and recommendations presented do not necessarily reflect the opinions of the Walmart Foundation. I'm now going to pass it to Tamara from Save the Children to dive into the learnings from these focus groups.
Great, thank you so much, Anessa. Yes, Save the Children was honored to partner on this great project. We want all children in rural America to have a healthy, strong foundation to thrive as learners and in life. And we know that children can't be hungry for knowledge if they're hungry for food. So this project lifted up a number of key related themes, and it's my honor to summarize them now. So the first theme that we heard loud and clear through all the methods that Inessa mentioned earlier is communication. The respondents talked about how crucial it was to ensure that families had the information needed to access food during the pandemic, especially in the initial months when we all went on sudden lockdown. It was particularly important to communicate and make sure families understood that all families were eligible to receive free meals during the pandemic because of the waivers that were enacted. A quick side note, even when that information that all families could access free meals, even when that was successfully communicated, we heard loud and clear there was still hesitancy among some families of children and not wanting to take food, thinking that somebody else might need it no more, or worried about the stigma or being embarrassed to accept free food. The irony of that, however, is because of the reimbursement structure, the more meals that a school or a nonprofit organization was able to distribute, the better off they were financially. So not only were the families that were hesitant to take the free meals, potentially, having their children miss out on great nourishing food, they also were potentially hurting the bottom lines of the very organizations that were trying to feed their children. But the challenges that we heard come up related to communication, the majority of the respondents said they relied heavily on electronic communication to get the word out during the pandemic about meals. Social media, one calls, text messages, email announcements, and the school or nonprofit's website. However, we heard that this presented a number of challenges when families in rural communities had run out of minutes on their prepaid phone. So they could not be contacted by either text messages or one calls. This was a widespread challenge in many rural communities. Another challenge is when providers shared the information about meals only in English, despite the fact that families were not English speakers. But we also heard from some great strategies to address these challenges related to communication. A number of schools and nonprofits were very creative in using alternative communication challenges, such as partnering with radio stations to do public service announcements, letting families know where and how and when to access food. A number of partnered with to set up billboard announcements so that even if families weren't able to get the OneNote or the text messages or access the internet website because they didn't have reliable internet, they could see the announcements that way. And then a number also were sure to kind of ramp up their efforts to distribute hard copy flyers through partnerships and other organizations that were distributing food boxes. A number also partnered with new colleagues to translate outreach messages, written and radio messages, to make sure that all families had the information they needed. And then finally, a number of school districts work to improve their data management system, and that's something that is ongoing beyond the pandemic. We heard a number say that they were really caught off guard at the lack of data that was up-to-date data that was available. So schools reported not having current addresses. They didn't know that a student may have moved temporarily to live with a grandparent. And so there was no up-to-date contact information and no way to share the information about meals with those students. So updating the data management system was another solution to that barrier. The next slide talks about transportation. This was another theme that came up over and over and over again. Transportation barriers arose both for program providers and for participants, the families of children. So rural communities, even outside of the pandemic, often have a lack of sidewalks or safe to schools or nonprofit routes, so that children can't access meals safely if a parent isn't able to drive them. Many children have to travel long distances. We heard respondents talk about children having to travel an hour or longer to access the school or the nonprofit site. Again, even outside of the pandemic, this was a challenge. already in many rural communities, but the pandemic, this challenge was brought to light even more. And another challenge was the difficulty that children had carrying bulk meals. So one of the waivers that USDA enacted that helped was allowing families of children to pick up multiple days worth of food at one time. The pro of that was that it helped for those families who were having to drive an hour or more to access food. They didn't have to go every day. They could pick up multiple meals at a time. The challenge was the children who didn't have somebody to drive them, that were walking to the sites by themselves and then carrying multiple days worth of food, really struggled to carry the bulk food by themselves. The solutions that were related to these challenges is the waivers. And we'll hear more about those later in the presentation. But one message that came through loud and clear, it is absolutely unequivocally true that the USDA eligibility waivers helped. Prior to the pandemic, rural communities really were hamstrung by the eligibility restrictions. They struggled to find a way to feed children after school and summer meals. The non-congregate waivers during the pandemic that didn't require children to sit down together, watched by an adult, and eat the food right on site. The elimination of that requirement during the pandemic made a huge difference. The ability for parents to pick up the food for the child instead of having the child eat it on site that I mentioned made a huge difference. Multi-day meal pickups really, really helped. So all the flexibilities provided by the waivers, almost every respondent mentioned an increase in meal participation as a result of those waivers. So non-congregate mobile meal delivery provide a great way to make sure that children in rural communities have access to the food that they need. And the pandemic really highlighted we cannot have a one-size-fits-all approach to feeding children, especially in rural, hard-to-reach areas. And then partnerships was another way that these transportation challenges were addressed, which we'll talk about in detail more. So the next slide talks about the third theme that rose up when we asked providers about some of the challenges to feeding children during the pandemic. Food safety and food supply issues were lifted up as a very substantial challenge. For providers, it was difficult to keep cold things cold when serving outside during warm and hot days. For participants, some families didn't have electricity in their house, and so they rely on coolers to keep their food at safe temperatures. Again, this is a challenge outside of the pandemic. We know rural families struggle in many instances with having enough resources to pay for food and their utility bills. But the pandemic certainly highlighted it in rural communities when families, the providers of the family were laid off or furloughed. It was a struggle that we heard quite frequently. So as a solution, the providers really talked about strategizing and thinking through what foods would keep the best once taken out by participants. What would families be able to keep at safe temperatures despite some of the challenges that they face with reliable electricity? And the problem is that it's challenging to be able to serve nourishing food, that fresh food, while also trying to make sure that it's easily transportable and making sure that the school districts and nonprofit providers were able to provide that food within the federal reimbursement dollars. It's very challenging. And then also recognizing that many children were taking this food home and preparing it on their own. And so a solution was that providers really worked to serve food that would be kid-friendly and easy for them to serve and eat on their own. Because of supply chain issues in rural communities, some focus group participants did say that they worried that the quality of the food they served went down as a result. They cited a lack of variety, damaged food that was received, and then the vendors that they worked with substituting food that the provider thought they were going to get for another item that may have been less nourishing or damaged or not kid-friendly. So there was definitely supply chain issues that program providers faced during the initial months of the pandemic, especially. And the solution, as I mentioned, in addition to rethinking how to safely serve prepackaged food, funding was required to do that. It's more expensive to prepackage food and to keep nourishing food at safe temperatures. It costs money. And so many of the respondents expressed gratitude for Share Our Strengths grant funding. Save the Children and other national organizations were also able to provide grant funding to help offset the cost of meeting this food safety and supply challenges. And again, I keep saying it over and over again, but partnerships really was another solution to this food supply and food safety challenge. A number of respondents talked about really innovative partnerships with farmers that help them maintain variety and overcome supply chain issues, while also supporting the local food economy by using some of these federal dollars to help local farmers whose own market had been just completely gutted by the pandemic when restaurants shut down and convention centers shut down. So it was a really great way to meet the needs of the local economy as well. And then the next slide, I'll finish up just wrapping up with the theme we've mentioned over and over again. Partnerships really rose as a great solution, both from school districts and community-based organizations that were working to feed children during the initial months of the pandemic. We know that no one organization or program on its own is going to be able to end world child hunger. So partnerships are key to leveraging one another's strengths, making sure we're not duplicating efforts and stretching our relatively limited resources even farther. And Save the Children, we're proud to be partnering and demonstrating this on a national level with Share Our Strength and others. But we also heard, and we'll hear more from Rachel and Katie about partnerships at the local level that really were key, like partnering with restaurants that not only helped the program providers access different foods and nourishing food, but helped garner some brand awareness, and the restaurant partners really helped spread the word among families to address the communication barrier that I mentioned earlier. Some of the respondents talked about really innovative partnerships with post offices where meals were distributed at the post office when families came to get their mail. Partnerships with fire departments was another a great opportunity to address these challenges. So we'll hear more from Rachel and Katie about these in detail, but that's kind of the summary of the high level things that we heard. And now I'll turn it back over to Anessa.
Thanks, Tamara. Next slide, please. Oh, thank you. Moving forward, our organizations plan on being intentional in pulling these learnings into internal conversations on how to not only better serve, but better understand rural communities and our partners working directly in these communities. This could involve informing strategy and decision-making related to grants, and or adapting and sharing of research and resources. So now it's time for the main event. We have Katie Rogers, a child nutrition director, and Rachel Jones, an executive director here, to share their perspectives in working in their own rural communities. So to start the conversation, I'd like to ask both of you if you could share a little bit about where you are situated geographically and some characteristics of your community.
Hi, everybody. Thank you, Anessa, for inviting me for this wonderful webinar. I'm so happy to share my experiences through the COVID situation that some still continue on. So a little bit about my community. Jerome is in southern Idaho. We are I wouldn't say extremely rural, but we have a very unique population. We're mostly Hispanic. I say mostly. Our 2010 census shows about 50% Hispanic. And I know that we have a very prominent non-citizenship population as well. We stretch about 600 square miles in the area. Our closest town is Twin Falls, and their population's probably in the 100,000s, but Jerome is about 20 to 25,000. In our area, we have a huge dairy and farm community. So a lot of our community either works for a farmer or on the dairy or in industrial environments such as the milk processing plants. But we also, so not only do we have the Hispanic culture, but we also have a very prominent LDS culture. And both of those communities do very well at taking care of each other. And I was previously with a district called Dietrich, Idaho, that was just up the road, and that was extremely rural. When I say extremely rural, they had 200 students K through 12, and that was about their population of their city. The closest town was about 10 miles away, and that's called Shoshone, Idaho, which is not any bigger than Jerome is. So yeah, we're pretty rural up here in Idaho.
Hi, everybody. I'm Rachel Jones. I'm the Executive Director for Farm to School in Montana, specifically Park County, Montana. You may have been here before if you visited Yellowstone National Park. We're located at the northern entrance of Yellowstone National Park. That's the south end of Park County. So as of 2019, there were 16,600 residents in Park County. 96% of them are white, and we have about 8,500 people living in Livingston, its county seat, where I am joining you guys today. Park County's economy is agricultural and, of course, now very much tourism based. I can say that the majority of the school-age children in Park County, which is about 2,000 children, they're enrolled in the Livingston School District. And then nearly half of them are qualified as low income. So the local food pantry estimates serving about 10% of the families living in Park County on an annual basis. And the percentage of students eligible for free and reduced meals is always about 50%. Which of course indicates significant household food insecurity. And then I just want to also say thanks so much for having me here.
Thank you both. So next question would be, who in the community do you feel are the most vulnerable or routinely not reached with existing food supports?
I think several of our families, they either have one form of transportation or no form of transportation, and I really experienced that over summer feeding. So I'm actually new in my role here. I started here in December. So our summer feeding was my first summer feeding, and I had, unbeknownst to me, knew what our program looked like. And I started up a couple new locations, which were very well received. But one of those locations, I noticed that there is a lot of students that they look like they don't have very good access to food, to put that lightly. And I noticed that a lot of them were either walking or riding their bike because mom or dad wasn't home. They were out working or they work nights, so they're sleeping. So the kids don't necessarily have access to food because they're either not old enough to cook or they don't have food in their household, whatever it may be. So they were able to get food through us and the COVID waivers and such. But I also know that, and I know this from my personal experience, I don't know it from my professional experience, but a lot of the dairy workers and the dairy owners take care of their employees. So they make sure that they have the food, the house, all the needs that they need to live and work. They have that locally. So there's a lot of the dairy farms that are 20 miles out of town, out of our town, that are their own little community. So that's pretty awesome. And additionally, we have the LDS Church, which I previously mentioned. They are very well known for keeping their community going. They're very localized, making sure that everybody has food. And if there are people that need food, they're working to get that to those families.
And in Park County, Montana, we're seeing that families who were already living at or below the poverty line, certainly they're the most at risk, especially after the pandemic hit. I don't think that's surprising for anyone, but we did see and we don't have specific numbers on this, but we did see quite a bit of families who were just above the poverty line or sort of teetering there, who experienced quite a bit of unemployment and changes in their income structure. And those folks were also becoming more at risk for missing out on all sorts of community services. And I'm specifically meaning like legal services and housing and mental health services, which are also, just interrelated with the food insecurity problems that we're seeing in our community.
And related to those populations not reached with existing food supports, what were some strategies that you put in place to mitigate these populations missing meals?
I'll take this one, Katie, to start. So, our community, I think, does a really remarkable job in working together to identify root causes of poverty, which really, in my view, need to be addressed first. So just to put that into context a little bit, Montana ranks, for example, #1 in the US in suicide overall, and 4th for youth suicides. And starkingly, Park County ranks 28 out of 2,727 US counties overall in the country. We don't think that this is disconnected from issues of poverty and food scarcity. In Montana, the highest rates of suicide are among American Indians. But also interestingly, this ethnic population represents only 1.2% of our population, according to the 2019 census data. So Park County has been suffering from youth suicides, and we can attest to the devastation of that each of these experiences creates, the anguish and the emotional turmoil and the food and school community. Affects learning at all levels. So specifically, some of the programs that Farm to School is exploring is actually involved with connecting the dots between diet and mental health, as well as economic supports in the community. We teach all kids K through 12 in Livingston, the county seat, where food comes from and how good nutrition can set them up for success in life. Our curriculum is considered a special in the Livingston School District, so it's just like PE or art or music. Of course, we also work with local public schools to improve meal programs, right? And we played a really leading role in rolling out an emergency meal program that started just in March of 2020. That program served at least 1,000 meals a day to at least 500 kids, and they were delivered along 17 bus stops every day. We also partnered with area restaurants, and Tamara mentioned that about how innovative and useful that can be in communities, but I can tell you guys about that later.
Thank you. And this might seem like a wishful thinking or very big question, but imagine that money was no issue. So you had been given the money needed to alleviate the issue of populations missing meals. What's some of the first things that you would do?
Personally, I love this question because I like to think about having no constraints, but to solving the supply chain issues, I would attack those first, specifically building high-tech greenhouses and training a new generation of food producers. I'm thinking that we might want to think more about what the inevitable rising food prices and scarcity of certain fruits and vegetables and nuts will mean to us in the future, as not only a micro community in Montana, but also as a culture and a community across the whole country. I guess one of the questions I have is, to what extent can we design in each community and raise a wide enough variety of foods locally And that would have to be defined as within a radius that will have to be practical. So how can we raise those foods in sufficient quantities to meet our nutritional needs throughout the year? So yeah, I'm a food grower and I just want to connect those with the people.
That's a great point. And I think that's super interesting on being able to raise your own fruit in your little practical area. I don't know if you guys have followed any of the news lately, but there's been the universal free meals that's been proposed in Congress and they're working on it. And that was one of the things that I saw tagged in there, was giving some sort of incentive for schools using local produce and local foods. So that's a great option. For me, staffing across the board. We, as a school district, we are the hub of our community. And right now, I've constantly been working with administration above me, trying to get more kitchen ladies and more supportive staff for our department. And it all comes down to funding for that. Food service is self-sustainable, supposedly. This year is very unique because we have the increased reimbursement rates, but in a traditional year, we're very on the brink of making it or going into the red. So having money to support staffing would be huge for us, not only in food service, but that translates over to summer feeding. And as the school district as a whole, we could, right now, our food pantry, we have 2 food pantries in the community. I think we have 3. We have a school district food pantry. We have Martha and Mary's, which is a local community-based food pantry. And then I believe we also have a soup kitchen from the Catholic church, but that's been shut down due to COVID and hasn't opened back up, which is a shame. But all of those across the board, they're volunteer positions. And with those volunteer positions, you guys know that they don't last very long. They get burnt out extremely fast. So to have the funding to support those positions, that would be huge in our community.
Thank you. And can you both speak to the stigma that may or may not exist in your community around free and reduced meals?
This is a super interesting topic as well, because free and reduced meals have been around for so long that everybody hears that and it's immediate stigma, either, oh, you're poor, or, oh, you don't eat very good food at school. So I think that's definitely interesting. And the pandemic certainly shined a light on the community and food insecurity that we have. And I know that I'm not the only one that's been able to see that. The community has really been able to see that, hey, these kids, Jerome has a 65% free and reduced population. I didn't say that earlier, but the community's definitely noticed it, and they've formed together to feed all the kids throughout the pandemic for the past 2 years. I can reach out to anybody in the community and they say, hey, yeah, it's to feed the kids, we're here. But for the stigma of it, it's difficult, but at the same time, our community's kind of overcome that and treating everybody the same. And I think the pandemic has helped with that, because there hasn't been a free and reduced population because everybody's been eligible.
Yeah, I could go out on that same limb, Katie, and just say that free and reduced meals is synonymous with like ew and gross across America. One of the silver linings from the pandemic for us was that it forced us, especially in schools, to wake up from the mindless habits of serving subpar meals to our school children. And the pandemic certainly increased, I think, community awareness and need and desire for bolstering against diseases and keeping immunities high, right? So because of that, that heightened awareness did in turn support sort of a drive for improving the meals in the schools, and we also improved supply chain issues. So, you know, in the end, I think some of our systems have been improved despite so many challenges.
And I'm sure this next question we could take the rest of the time with it. But what was one or two of your biggest challenges in feeding kids during the pandemic?
So I think I can speak for a lot of food service directors out there and say the supply chain, and it still continues. The supply chain has been disrupted tremendously, and we're not seeing any alleviation from it. In fact, before this webinar, I received 3 or 4 emails with either price changes or outages for my food that I'm getting next week. And during the summer, it was terrible because now everybody's been closed. So we don't have any schools in session across the country, but we still have to feed the kids. So how do we do that? We need prepackaged meals. We need the packages to send the meals out. But now everybody in the whole United States is needing those. So they're everywhere and not anywhere you can get them. I think, and this was before my time, but I think I heard we actually served a lunch that was a packaged peanut butter cup, a packaged jelly cup, and crackers to make a peanut butter and jelly sandwich. That's how bad the supply chain was disrupted for us. One of the ways that we kind of alleviated that, and it was a benefit to us to use our USDA foods, was we found these cupping machines. I'm not sure if you guys have ever seen them, but they're little heat sealers. You put your plastic cup in and you seal it on top, and it cups your fruit for you. So we were able to use our USDA foods there, luckily.
Oh, that's great. So as Katie was chatting, I was thinking, like, you know, to all of the participants here, have you thanked a food service worker lately? Because they sure need it. And I'm not a food service staff member. I want to be really clear about that. But I do have the privilege and the joy of working alongside a lot of lunch ladies. And that is a term of endearment, by the way. So I have certainly prepared and packaged and delivered a lot of meals in the last 2 years. School food service staffing shortages continue to be the biggest challenge on a day-to-day basis for Farm School of Park County and for the food system in general, the school food system in general, to reach its goals. We have a lot of work to do in regards to working with the unions to increase the kitchen staff salaries so they're competitive and desirable in the community. And then second to that, schools in our county are in need of serious equipment and kitchen upgrades too. So workers really need reliable kitchen supplies, kitchen equipment, ovens, refrigerators, milk coolers, tilt skillets and steamers, all those things. And they need safe environments to do their jobs. Some of our schools are 40 years old now, and they're just outdated. It's time to turn that around. The lunch lady culture has had, at least I can speak for here, sort of a we'll get her done kind of attitude on a daily basis. And that's wonderful because they get so much done. But it always comes at the physical and emotional expense of the staff. So I would really like to see that turned around.
Thank you both for sharing that. This next question, again, we probably have many instances of, but could you share an instance when you had to think outside the box during the pandemic when providing food to participants?
So for Jerome, and like I said, this was kind of before I was here, but I think they did an amazing job. And it wasn't just us. I saw it kind of across the board throughout the nation. So it was probably done locally at everybody here's level. We worked with the bus barn. We contract our busing out as a school district, and we worked with them to supply foods via the bus routes. So even though school stopped, our buses didn't. They still continued out through their routes, and we just had a food service lady on the bus delivering meals to each stop. And again, that was done by COVID waivers. Had we not had those waivers, we wouldn't be able to do anything like that.
Mm-hmm. Yeah, so same here. We were able to support the school district in rolling out a very similar sounding meal program. And then I'm also really proud that we created a restaurant partnership. And so I guess I'll just back up a little bit. So shortly after the pandemic started, our food service staff was so shorthanded and fatigued that this whole system was really almost on the verge of collapse. We had about 3 to 5 workers preparing, packaging, and delivering up to 1,000 meals every day. At the same time, our local restaurants were really struggling to survive. So we invited restaurants in to help prepare and package meals. 9 restaurants took us up on the offer, and they had to agree to certain budget, nutrition, and logistical rules. Some provided whole, well-balanced meals, like all of the components of the meals, and then some provided just single components of the meals. So it wasn't a one-size-fits-all partnership. And then, because of that, we built a very strong relationship with one of our local chefs. She was really the shining star of the program, and her name is Carol Sullivan. She's kind of like our local celebrity chef Anne now. I'm really proud to say that we have been able to continue working with Carol throughout last school year and then also this school year. And now she is working for Farm to School as a kitchen consultant and works alongside the lunch ladies on a daily basis to inspire and redesign their recipes and menus and budgets. So something that we probably never would have been able to do was made possible just out of the innovations of feeding kids throughout the pandemic.
That's really cool. And as we heard Tamara share earlier, partnerships was a huge theme that was pulled out from our focus groups in terms of the elevation and the relief that it provided some of the food service staff, to your example of what you just shared. And Rachel, was that a new partnership?
Oh, absolutely. Mm-hmm.
Very cool. And Katie, do you have an example that you could share of what maybe your most impactful partnership was during the pandemic?
Yeah, absolutely. And I think as a community, all across the board, it's been amazing to see everybody jump in, and it's all been for the children. I think that's awesome. Our school district actually has a partnership called Community Schools, and it's led through United Way. So it's a group of myself, the food service director, the coordinator for both food pantries, the school food pantry, and Martha and Mary's, our federal programs director, who is also our homeless liaison, and of course our United Way lady. We also have the Idaho Food Bank and several other school district administrators and teachers. So it's a very broad array of different community members. We've formed together to start this picnic and play, which started over the summer, and I loved it, and it was so well received from our community. So picnic and play, our summer feeding was Monday through Friday at the park here local, and the picnic and play we had on Tuesdays and Thursdays. So we reached out to members of the community, the local banks, the gas stations, different businesses, to come and participate in some activity at the park, to engage more kids to come and stay and eat a meal. And it worked out so well. We had kids saying, "Hey, what's the activity today?" when they came to get their meal. And we had different, so I think our participation was, 100 to 150 more on Tuesdays and Thursdays just because of that picnic and play. And that's something that we just decided to do because COVID had these kids locked in their house all school year. So the summer, COVID kind of took a break from us and we were able to get out and enjoy some things. And that's one thing that we really wanted to do, get the kids outside. And it was so positive that we're gonna continue to do it on a yearly basis.
Is a great segue into my last question, which is what you feel, possibly aside from helping feed kids during the pandemic, what you feel your biggest success was.
Do you want to go ahead, Rachel?
Oh, sure. I think I said this before, but in my opinion, the pandemic really forced us to wake up from, again, those mindless ways that we were sourcing and consuming food and how we understood its value. I think it's time for us to take further action and keep things moving in a positive direction. For example, families are finally becoming aware of the threat of diet-related diseases and how and why to stave away disease nutritionally. Communities need all of its citizens to be healthy right now. Families and teachers are fed up with disgusting school meals and 15-minute lunch periods, right? These are countless ways and instances where our communities are collaborating to provide not only locally grown food, but scratch cooked food to those who are hungry. And I'll just continue to be considering the ways that things were, how things were before the pandemic and what was learned in the last year and how desperately the flaws in our food system need to be remedied.
Thank you for answering all of those questions. I want to open it up now for audience questions. If you have a question for either one or both of our experts, please type in your question in the Q&A function in the Zoom toolbar located at the bottom of your screen. We also provided a space when individuals were registering for the webinar where they could submit questions, and we did get a few in that way. So while we're waiting for participants to type in their questions, let's move to one of the pre-submitted questions, which was if either of you, which I think both of you probably, have suggestions on how to deal with staff shortages.
So staff shortages for us, I actually kind of have a unique problem. I spoke about it previously, how our culture is very Hispanic. And I actually don't speak any English, or sorry, any Spanish. So I do speak a little English. So we have a staff shortage actually right now because of COVID. So I have several people gone with COVID and our sub list is very small. The problem that I have is coordinating in each kitchen, Spanish speaking and English speaking. So right now I've actually promoted one of my cooks to a manager position and she doesn't speak a ton of English. We're able to get along, but having a conversation is kind of difficult. And I'm able to put more of the Spanish speaking in that kitchen. I had one lady that she didn't speak any Spanish, so she asked to be switched at a different kitchen. So it's just kind of a domino effect. And when I have people apply, I actually ask them to apply to be a sub first. So it's kind of like our trial and error pool, I guess you could call it. So they apply to be a sub and we hire from the sub list. So we get to learn about them better than we can from an interview, and they get to see what the job entails, because being a cook is different than being a lunch lady. Really, if you're going to be a cook at a restaurant, it's a completely different atmosphere than it is in the school cooking position. So they get to see that, and if they like it, they can stay. We have several employees who either they have to leave for different reasons. So our sub pool is constantly revolving back and forth. I hope that kind of answered your question.
I can chime in a little bit too around staffing. We're taking a pretty unique approach to that right now. And I hope that other schools around the country are doing this. I'd love to hear more stories about that, and especially community-based organizations that are supporting this, but really sort of flipping the script on what the stereotype of lunch ladies is and what kind of a work experience that is. So we're asking questions like, how can we make the school food program a desirable place to work? And of course, we have a lot to do in regards to working with the unions and working with the school administrators and creating a job structure and compensation rates that's in line with what could be attractive for folks. But just as an example, from School of Park County, we're taking a lead role in facilitating discussions around how to establish those competitive wages for food service workers. And those are difficult conversations to be having. I also work with the food service director to rewrite job descriptions and posting them in ways that are more attractive to a broader segment of the workforce. We really are pushing the envelope and envisioning a new food service culture that we hope is exciting for people and something that people want to be part of.
That's a really good point, Rachel, about kind of re-innovating the food service worker. And I'm working on that myself as well, because right now our school district, if we have an opening, they post it on our school district website. Well, if you're looking for a cooking position or an entry-level position, you're not going to go to a school district to find that. So when I first started, I posted on Indeed and Facebook and all the different venues for that. And I got really good feedback from that. I think that's a great point is, you know, food service workers, yeah, we're lunch ladies, but we're not only lunch ladies.
And that's a nice segue into a question that we got from the audience, and it is directed at Katie. Rachel, if you have anything to add, please feel free. But what were some strategies used to get the word out in the Hispanic community about summer meals?
That's a really great question. My secretary speaks Spanish, luckily, otherwise we wouldn't be able to be in the position I'm in. So we posted different flyers. So every time we post a flyer, post on Facebook, it's also in Spanish. We have a local radio station called La Chupacabra. It is a Spanish station, and he posted for it, or he said it on the radio, you know, here's our food service hours. And a lot of the Hispanic culture listens to the radio. But one thing about it too is they talk amongst themselves very, very much. So if one person knows about a free meal being handed out, everybody in their neighborhood is going to know about a free meal being handed out, and pretty soon you're going to have everybody there. So yeah, I think just translating everything back and forth. We also have a Swift Reach venue to use, which is through the school district. It's all of the school or all of the students' contact information, and we send an email and it goes to all of them. One thing I've found with that is it's not very effective for that specific population. We've been dealing with PEBT for us. I don't know if you guys have that or if it's just an Idaho thing, but it's the biggest pain in the neck because of miscommunications. So I think that's probably a huge challenge that we constantly fight day to day. But yeah, just communication by word of mouth and throughout the community.
Great. It doesn't look like we have any other audience questions. So I think we can move forward on the next slide. So thank you all for your interest and attendance in today's webinar. On the screen is the contact information for today's speaker. So if you have any follow-up questions, please feel free to reach out. We hope that you all have a wonderful rest of your day and be on the lookout for a accompanying resource, the slides, and also a recording of this webinar. Thank you all.